Assalamu alaikum again, and this is the third presentation that we're going to give as a pre-course lecture for advanced endoscopic skull base that going to take place on February 1st and 2nd, 2020. In this presentation, we'll discuss paranasal sinus. I'm going to use the right nostril to demonstrate the anatomy, and I'm going to alternate between dry cadaveric mucosa of the nasal cavity as well as uh, fresh mucosa from surgery. We'll start with this, and you can appreciate here through the right nasal trail, and opening is the septum medially. Laterally can see and appreciate middle turbinates and inferior turbinates. In the back you can see the choana or the opening of the nasopharynx. Here in the dry cadaveric nasal cavity, you can appreciate again the septum, middle turbinates, inferior turbinates, the choana in the back, and also you can appreciate laterally to the turbinates is the middle meatus and inferior meatus. We'll discuss furthermore the anatomy inside the middle meatus. So if you retract the middle turbinate medially, you'll be able to appreciate better the middle meatus and the structure in that corner, which include the pola ethmoidalis, which is bulging of the ethmoid cells, sinus, and as you can see it here also in the coronal CT scan. Also, you can appreciate the answering process, which is a curvature line that make an opening and the hiatus to communicate the sinuses, in particular the maxillary sinus, and as well as ethmoid and frontal sinus through the maxillary sinus to the nasal cavity. And here you can appreciate both structure in the coronal CT scan as well as on this fresh mucosal anatomy. In the same time, you can appreciate the axilla or the root of the middle turbinates as well as the middle turbinate. And at this image, you can appreciate the dry bone anatomy of the middle meatus. You can see the middle turbinates, the axilla of the middle turbinates, and then the ansonate process, the pola ethmoidalis, and you can see also here projection of a lacrimal sac. Anterior to that is the lacrimal bone and duct. Now, if we retract the middle turbinates to the lateral toward the middle meatus, we'll be able to see, of course, the septum and the back of the nose. Two circles going to be appreciated. The first one is the sphenoid ostium here in the back superiorly, and just posterior to the superior turbinate. The superior turbinate, you can see here, is really not superior, truly superior to the middle turbinate, but rather it's posterior to the middle turbinate. And also you'll be able to appreciate the choana or the opening of the nasopharynx. You can see it here in the sagittal view of the CT scan. And in between the two is very important area, which is the pedicle to the septum. This is very important to understand and appreciate when you raise the septal flap. We're going to have a special presentation for that, but for now we need to understand this pedicles of the septal flap is very important to preserve if you're trying to have a septal flap, as the blood supply to the septum going to come through this pedicle in a form of sphenopalatine arteries. And now we're going to remove the middle turbinates to see better the middle meatus. So we inject xylocaine, and then we're going to use the turbinate scissor to cut the axilla of the middle turbinates by tilting the scope, tilting the scissor slightly and go inside and cut the turbinate from its root and push it down, as you can appreciate and see here. And in fact, you see the turbinate artery in the back. And by doing that, now we have full exposure to the middle meatus, as you can appreciate it here. And in the middle meatus, you can see again the bulla thymoidalis very clearly, as well as the ansonate process. And now you can see also clearly the natural opening of the maxillary sinus, which is the maxillary ostium. Uh, if we remove the septum and go back to try to see bilaterally the sphenoid ostium, this is what you're going to see, and we're going to drill the middle of and the face of the sphenoid sinus, and even the septum, which is separating the sphenoid sinus to left and right. You'll be able to see the face of the sella here. And now going a little bit lateral on both sides, you'll be able to appreciate further the anatomy of inside the sphenoid sinus, which include the sella in the middle. Superiorly is planum sphenoidale, inferiorly is the clivus and sphenoclival recess, and laterally optic canal impression, as well as the internal carotid artery. And in between you have lateral OCR, as you can see in here between the optic and the ICA. And by doing that, now we expose fully this face of the sella. We're going to conclude this session at this stage, but be sure that you try to memorize this image where it shows the face of the sella with the surrounding structure. Thank you very much.